doctors or medical practitioners. And so today is no exception. I have two distinguished doctors in studio. One is from India, one from Liberia. And we're going to be talking about your eyes today. Everything you want to know about your eyes. This is World Eyesight.
Yeah, this way to want to talk.
All right. And they're going to tell you more about it. I have in studio Dr. Sree, Sweta, Ramavath. I hope I got it correct.
Yes.
Yeah, she's the one sitting right by me here. She's from India. And I also have Dr. Gobeh, also from the JFK Eye Center. Both of them have been here before. I mean, he has been here before on one or two occasions. And so, we kick the ball rolling by asking them. And first of all, let me thank you for coming.
Thank you for inviting us.
Right. It was, like Dr. Allen said, the invitation was too abrupt. But I'm sorry. It was just it was day before yesterday that I got in touch with you people, and thank God you agreed to come. You know, one of the reasons for this program is to help the public. Many people are sick today and don't know where to go. They sit at home and just die. And so when you come and inform the public about what to do concerning their health, it's good for me and good for the public. So thank you. Please introduce yourself briefly for 30 seconds.
Sure. So good morning, 99.9 FM and all the listeners.
Right.
And I'm so glad to have been invited to this talk show. And it's an honor to be here amongst all of you. And I'm glad that all of the listeners are tuning into this program and listening to Mr. David. I'm Dr. Sree Sweta. So I'm an ophthalmologist. I specialize in cornea and anterior segment. So I work for L.V. Prasad Eye Institute. And currently I'm on a voluntary posting at the JFK Liberia Eye Center, which is a collaboration that we have with our L.V. Prasad Eye Institute. That's about it.
Thank you very much. You're so fluent, man. I thought your English was going to be that, but it's very clear. I like that. And before I go to Dr. Allen, let me inform the public that we're on Facebook. Please go to my page, David Kortie, Kortie. Go there and please share the show. It's good for the public. It's good for the public. Go there and share the show so that more people can benefit from this initiative. Dr. Allen, please introduce yourself.
Thank you for having me. My name is Dr. Allen S. Gobeh. I am an ophthalmologist, also working at the JFK Eye Center. Thank you.
Now, an ophthalmologist, like they said, is a doctor who is specialized in eye diseases. We have different type of eye doctors. They are ophthalmologists. Let's start with you, Dr. Sweetie. No, not Sweetie. Yeah, Sweta. Or Dr. Ramavath. I'll get used to your name.
Yeah, that's okay.
Okay. Please tell me a little bit more about the World Health Day. I mean, the World Sight Day.
Okay. So the reason why I feel that we need to have a day dedicated to, I think, one of the most important aspects of our daily life, which is basically vision. And so the reason why we need to have a day is just to celebrate the fact that all of us should be grateful to the fact that we're able to see and visualize the world and appreciate God's creation, the way it is. So like every year we celebrate a day, which this year is on October 9th. And so the importance is that the theme that this year is that we have to love our eyes. That is the theme.
Okay.
So love your eyes is actually a very broad terminology, and love your eyes goes a very long way. So I would like to just I would like to just ask a question to everybody, is that, when you think about it, when you get up in the early morning, when you open your eyes and when you just see the world the way it is, how grateful are you for the fact that you're able to just, appreciate everything the way it is? So that starts with how much care are you actually putting in and how much care are you taking about your eyes on a daily basis. So what are you doing to protect your eyes? How are you taking care of them if you are not seeing properly? How important is it to go to an eye clinic? How important is it to get a diagnosis? How important is it to debunk all the myths that we have in our brain? And how important is it for us to take treatment? And how important is it to always come back to the clinic? And so this is very important. Eye care is, I feel, directly proportional to the economy of a country.
Yes.
Because when you think about it, eye care is what is going to give you a very good education, a very good job, and it's going to give you a very good, position in the society.
Yes.
And that's exactly proportional to the productivity of the country and the
Yes.
economy of a country. So I think that's very important. Eye health is everything
Yes.
for me.
I agree with you. We'll come back to you. Let's go to Dr. Allen a little bit. What do you want to add to that? I think I agree with Dr. Sweta. Yes.
Yes, I mean, Dr. Sweta spoke a lot of good things. What I want to add is just that World Sight Day has actually been a historic event.
Okay.
It is a day that's set aside to make awareness of our eyes and to also attach, the significance of maintaining our vision in terms of eye care.
Mm-hmm.
I think its inception was somewhere back in 2000s, but if you really trace when it started, it was in the 90s.
Okay.
There was a campaign called the Sight First campaign,
Mm-hmm.
and this was hosted or supported by the Lions Club.
Okay.
So that was the inception of the World Sight Day. It was then adapted by the Vision 2020
Okay.
to be an awareness day, and it's held on the second Thursday of every year in October.
Okay.
So this time it happened to be on the 9th, but usually it's a weekly event.
Oh, a weekly event. Okay.
Yeah. So
I thought it was just one day.
it's a one-day event, but we usually extend it up to a week, because we have some activities to.
Now, coming back to activities, come back to you, Dr. Sweta.
Yes.
What are some of the things that you're going to be doing on this World Sight Day? What are you're going to be screening? You're going to be parading? What will you be doing?
So this World Sight Day, we've gone ahead with the concept of screening, because I think it's very important to find out eye disease at an earlier stage, so that we can treat it better.
Yeah.
So this year we're going ahead with screening employees at the Ministry of the Health and the Ministry of Transport.
Okay.
And so our activities mainly are including to look at what is the refractive error. So refractive error is basically, do you actually require spectacles or not?
Okay.
How much amount of visual hindrance do you have that you need any treatment for?
Okay.
So screening for refractive errors, screening for cataract, screening for glaucoma, and screening for diseases that can actually be picked up and treated.
Okay.
So that is our main goal, screening.
Okay. Preventable problems.
Okay.
There are issues that are preventable, but it depends on you. If you are sitting at home for 365 days around the clock and don't care to check any hospital, then you are in trouble. But if you go by yourself, it's better. Tell me a little bit about cataract. We have got some misinformation here that cataract, when you go for an operation or surgery for cataract, they will have to remove, the doctors, the ophthalmologists, will have to remove the eyeball, operate on it, and put it back. How true is that?
So I would like to first debunk this myth, and so I was kind of surprised because this actually happened to me when I was in the OPD, and a patient actually asked me if I would take out her eyeball and I would put it back in and I would put something else in it. So I I understood that this comes with a lot of communal teaching. Like everybody is learning the same thing, which is absolutely wrong.
Yeah.
Everybody is hearing something wrong. So I think I'll first debunk it. Okay, cataract is something that can happen. Usually it happens to in an elderly population.
Yeah.
There are some times where it can even happen in the younger population as well.
Okay.
But it's a very, very treatable condition. I would even it's like one of the most common causes of treatable blindness. We can actually treat it, and there is no way that we are going to remove your eye. There's no way we're doing that. It's just we're going to just remove the cataract, that is the part of the eye which is affected, and we're going to just put a lens in the eye so that you can see better.
Okay.
Yeah.
Dr. Ali, you want to add to that before I give my testimony?
Yes. When you look at world statistics, especially in terms of vision impairment,
Yes.
there are what they call preventable vision impairment, and there are also non-preventable.
Okay.
So the preventable ones, cataract is the number one cause. With cataract, you do a surgery, everything is okay, the patient is fine, as long as the other parameters like the back of the eye health is fine. Okay? The next cause of preventable blindness or preventable vision impairment is refractive errors. And this is even topping the list above cataract.
Refractory.
Just simple use of glasses. And that's all it takes. A child who was reading their copybook close to their face can see better. A child who has to go close to the blackboard can even stay at 6 feet or 20 feet and see the blackboard just by simple use of glasses.
Okay.
So those two things are our primary focus, especially when it comes to screening, and we want to make sure we reach out as many people as possible.
That simply means if you detect it early and know that you need to use glasses, you are safe.
Yes,
And if you don't know that you need to use glasses, then there's a problem.
that's the problem. So we want to make sure that we make people aware of this situation and how they can also get the needed treatment they require.
Yeah.
So I would just like to add a small point here. So this reminds me of, another patient who had come to our clinic. So he was like a 15-year-old male child, and so his mother had brought him to the clinic and saying that his education is like his grades were dropping down. So we took we just sort of screened him for and he did end up having a very high refractive error. And it was surprising that with such a high refractive error, he had lived almost 15 years of his life without being deprived, being deprived of the fact to visit an eye clinic and use glasses and spectacles. Can you imagine? It was painful for me, and I was asking him, "How are you doing it?" And he was just quiet. He wasn't talking much. He was very shy, and he was just he said, "Yeah, this is how I'm doing it." So I think this is something that we can actually treat. So I would just recommend, and I would just really request all of the listeners, if you have children, and I would request the teachers, because I think teachers are one of the most beautiful professions that they have are teachers, because they see children on a daily basis. They can pick up children who are who they feel are definitely having some vision problem, and they can inform their parents. And the parents can bring them to the clinic.
Yeah, but you have to be a trained teacher to do that.
Correct.
It's like your medical field.
Yeah.
A lot of people are getting into it, but they don't belong there.
I see.
Now, you are specialized in something. I'm going to ask you to tell me about it. But if you are a gynecologist, a gynecologist is a woman doctor, specializing in diseases for women, and you are not an ophthalmologist. You don't have that idea, and a person comes to your clinic and says, "Look, I got a problem with my eye." And if that's not your area, my friend, let them go to where they're supposed to go. Refer them to an ophthalmologist.
Correct.
It happened not too long ago, but 3 years ago. Somewhere, somebody did a surgery on the lady's eye, and then they messed it up. After a week or two, it became worse. It was at the JFK Eye Center that it was corrected. Not even totally corrected. They work on it and refer her to go to India or any other place. So I'm saying here, your area, die your area. We used to have a song in this country during the campaign, your area, die your area. If it is not your area, don't go there. Don't embarrass people. So, I am saying now, I want to say quickly about this cataract issue quickly before I come to the next question. I want to agree with you, let the public know that you are right. I have done 2 cataract surgeries, one in the left and one in the right eye. No doctor removed my eyeball. It's still right there. In fact, another thing they tell people is so painful. That's not true. They would, fine. Once they numb that place, my friend, you're lying down there talking with a doctor while they remove their cataract. So it's not painful. So it's a lie if anybody tells you that your eyeball will be removed in order for the operation to take place. That's not true. Because if that happens, the optic nerve at the back of the eye will be destroyed. The optic nerve in the back of the eye is connected to the brain to enable you to see. Now, if that is destroyed because of the removal of your eye bulb, you'll see no more. The only time an eye bulb can be removed is when it comes to enucleation, where they have to remove your entire eye bulb because it is damaged for some reason or because it has cancer. That one it has to be removed, and it's already spoiled. So thank you very much for this clarity, because a lot of people are afraid to go do their operation because of that.
I know.
Yeah.
I can understand.
Now, can I come to another thing quickly? Glaucoma. Please let us talk about glaucoma a little bit.
Sure.
This is a silent killer. Tell me a little bit about glaucoma.
So glaucoma is it's a disease in which most of the time I've seen
I'm sorry for in fact, before coming to glaucoma, I want to go to your area first.
Yeah.
You are specialized in a particular area.
Yeah.
Please tell us about it a little bit before we go to glaucoma. I only brought that in because it's a major problem in this country.
Sure.
Glaucoma is asymptomatic.
Sure.
That means it has no sign at the early stage. And most people don't know. And they stay at home and stay at home. They don't even know the signs and symptoms.
Yeah.
And so when it gets worse, my friend, glaucoma, when glaucoma destroys your eye, it is irreversible.
Correct.
No doctor in the world will bring it back.
Yeah.
So we'll talk about that a little bit, but let's go to your area first.
Yeah.
You are specialized in something. What is that?
So I'm specializing in cornea and anterior segment. So in the eye, we have two parts. That is the front part of the eye and the back part of the eye. Okay. So I'm specializing in the front part of the eye, which is called as a cornea, and the anterior segment. So on a daily basis, we tend to deal with a lot of corneal infection, corneal trauma, and different diseases that are associated with the front part of the eye. So, and that is basically cornea. So when you see, for example, I have seen a lot of patients who come with, they just come with a history of being injured in the eye with maybe a foreign body or like a wood particle, maybe some 2 to 3 weeks ago, and then they come to the hospital with a lot of redness, pain, photophobia. They cannot see anything. And so these kind of patients are the patients that we actually take a look at. We look at and see if the front part of the eye is involved. We make sure that we find out if it's a bacterial infection or is it a viral infection or what is affecting the patient and how to go about managing these kind of patients. And so we see even like pediatric, even children come with being injured with so many objects on a daily basis. They get injured with nails, they get injured with knives, and we deal
because
with
they're playing with their colleagues, their friends,
correct.
and somebody hit it with something.
And surprisingly, I keep asking them, what was he doing with the knife? And they just say he was playing with it. And I'm like, he should be given another toy to be playing with.
Not knife.
Not a knife, man. Come on, give him something else. So yeah, most of the times they come with these kind of injuries, and this is what we manage. We try to, whatever has been done, we try to sort of treat that. We treat the corneal trauma or we treat the corneal infection or that the way it presents to the clinic.
Okay.
So that's what we deal with.
Now, tell me about boxers. Muhammad Ali, Joe Frazier, all these people who box and hit in the eye. Does that cause corneal problem too?
Definitely. If I think if he is hit him too hard, I think everybody is bound to have some sort of a trauma at some point of stage. But if you're careful, you cannot get injured. But there's always a risk of being injured to the eye. So that's the reason why I sort of always. So patients who come with a one-eyed status, which means that they have already lost one eye and only the other eye is functional, I make it a mandatory point that I emphasize on so much that they have to wear glasses no matter they don't have a power, no matter they have power, they have to wear glasses on. They have to be protected because that is the only functional eye, and they have a very, very long way to go. It's like they have to live beyond more than 60 and 70 years. So this is also a sign, requesting all the listeners that you need to wear protective glasses.
Yeah. Okay, coming to the glasses. I will come to you now, Dr. Allen. Gobeh, forgive me if I keep calling you Dr. Allen.
That's all right.
People sometimes call me Mr. David.
That's right.
Yeah, I do. I call
Okay, yeah. So it's not bad. talking about wearing glasses, is it safe? Two questions into one. Is it safe to just go to any place without any prescription, no test? The ophthalmologist has not diagnosed your case. They haven't tested your eye. But you just go to any shop and just buy reading glasses and keep using it. And what about these people who wear dark shades, dark goggles? Is it safe to just buy glasses from anywhere? Or you should find the one with the UV rays, 400?
So that's a good question. I usually will conscientize anybody that if they have issues with their vision, it's important that they get it checked. And the reason is just simple.
Yeah.
The problem may not be because you have a refractive error. It might just be you have a disease of the eye that is causing your poor vision. So if you went to buy a glasses and you think the glasses will help you, mind you, you will just be worsening that disease that is ongoing, which you don't know about. So it's safer to get your eyes checked if you have a vision problem, and not necessarily to go in the streets and buy glasses. Now, there are also other instances when it's important that you use glasses. I'll give you an instance. Somebody I saw yesterday that was at a workplace, and while working, a nail ricocheted and pierced the eyeball.
Well, let me get that again.
He's a carpenter.
Okay.
So while nailing something,
Okay.
he hit the nail, it snapped, and it got on his eye.
My goodness.
Tore the eye into two halves.
Oh.
Yes. So we had to go in there and fix the eye. Now the question we asked, were you wearing or do you have a protective glasses? He said yes. But unfortunately, he did not wear it at that time.
Oh, yeah.
When we asked why, he said it was fuzzy.
It was what?
Fuzzy.
Fuzzy. Which means?
Which means he could not see clearly with it.
Oh.
So he does his work without it.
I see.
And this is how he got injured in the eye. So I say this to me, it's important when you are at a workplace and you do a work that is risky, whether working with metals or welding something or you have splashes to deal with, it's important to wear protective glasses.
You know what you're reminding me about?
No.
You're reminding me about people who drive and say, I don't feel good when I use a seatbelt.
Right.
I feel comfortable without seatbelt.
Right.
Can you imagine that?
And this has been like a kind of thing that happens in Liberia. People take things for granted.
Granted.
You know. But I always tell people, and for you listening out there, the eye is so important. There are things on the eye that when they get damaged, it's difficult to fix. If possible, impossible to fix. So it's important you protect your eye. And this is one of the reasons why the team, Warside Days, is that you love your eye. If you love your eye, you will pay attention, you will protect your eye, and not only that, you will have a health-seeking behavior towards your eye. If you love something, what do? You invest in it. And so I want to urge all the listeners to please check your eye. Don't go and buy glasses in the street. See an ophthalmologist or an ophthalmic nurse or somebody with the training of that equivalence and let them evaluate you.
Okay. You want to add to that, please?
Yeah.
Especially on this, going to the particular person, and besides that, this early detection. You want us to talk about that a little bit?
Yeah.
Why is it necessary to leave your house and go to the hospital? Like in my case, from the time of my surgery, I have been taught to always visit the place 2 or 3 months every time, and I do that. So, what about people who have never been there before? Do you advise them to go and do some early check?
Yeah. So I think the amount of time that you invest in visiting an eye clinic and getting yourself checked up, and even though if it's for the good or for the worse, even if you're diagnosed with something, at least you know you have it.
Yeah.
At least you know that it is being diagnosed. At least you know that you can treat it. And I think it's always important to invest in time when it comes to your health,
Yeah.
because in the long run, that is the currency that is what is going to let you sustain for a longer period of
Then
time.
let me talk about that quickly before we take a break. I'm a glaucoma patient. Apart from removing the cataract from my eye, I have 2 new lenses now that are there forever. Yes, they're there forever. But I'm also a glaucoma patient. And I got to know that 8 to 9 years ago. And I'm trying to support what you're saying, to know that you have it. Because I know that I have glaucoma, I've been taking my glaucoma eye drops for the past 9 years. Oh yes, 9 years. I got to know this 9 years ago. And from that time, the doctor, the ophthalmologist, said to me, you need to take your eye drop every morning, every evening. 2 different types. For the past 9 years, maybe this is why I'm still moving and driving. What if I didn't know? So early detection is a key. Get out of your house today. Go and check yourself.
Exactly.
Don't think you're okay. Some beautiful ladies came to my compound one day. They were taking pictures. And I was, oh, I love my eyes are blue, beautiful. I said, okay, your eyes are blue and beautiful, but are they beautiful inside? Are they beautiful? Yes.
That's a good one.
They're beautiful.
Yeah.
Yeah. They're looking beautiful outside, but are they beautiful inside? Do you have cataract or not? Do you have glaucoma? You don't even know what's happening, but all you know they're beautiful.
Correct.
We'll be taking a short break in a few minutes from now, and when we come to you, the callers or the listeners, after the break, we want you to call 0777 511 977. 0777 511 977 or 0886 511 977. Those are the numbers you will call to participate on the program. Ask these 2 doctors any question about your eyes. They will be able to answer you. So we've got 2 minutes to the break now. What do you want to say before we go to the break? What do you want to say?
So, well, I just wanted to talk something about glaucoma.
Yeah.
Because it is an issue.
Yeah.
Worldwide.
No, that is
Liberia,
an understatement. You say an issue. So very serious
it is
issue.
a severe issue. And Liberia is of no exception. So glaucoma is the leading cause of irreversible blindness. What does that mean?
Please explain.
You get blind by this disease, and once you are blinded, there is no going back. There's nothing any ophthalmologist or any doctor anywhere can do to bring back the vision you have lost.
Okay.
Let me be very clear about that.
Yeah.
And this is simple. Glaucoma damages the optic nerve. There is a nerve at the back of the eye that takes information from the outside world to make you to know what you are seeing and relay that information to the brain. It is that nerve that is being damaged. So once you lose that nerve, it doesn't heal. So it's important for people to have their eyes checked.
Yeah.
Glaucoma, in most cases, will not produce symptoms.
No.
You go to the eye clinic for another reason, and the doctor finds that, wow, you have glaucoma, and you need to be on treatment, eye drops for life.
For life.
Or, if not, surgery.
Yeah.
So it's important to love your eyes by checking your eyes.
Always.
If you love your eyes, or if you love anything, you pay attention to those things, or to that thing.
Yeah.
So love your eyes by checking your eyes. Come to JFK,
Yeah.
and we can see you there and take care of you.
Thank you. Before we take the break, one of the major reasons for glaucoma is high pressure in the eye. The eye pressure is different from your body pressure. Your body pressure is normally 1/80. When you're getting older, it go a little higher. But your eye pressure should be between 10 and 20 millimeter. Is that correct?
Correct.
All right. And if you allow it to go more than that, the pressure in the eye would be high and it would cause glaucoma. But sometimes your pressure can be normal and you still have glaucoma. Yes, not only the high pressure, the pressure can be normal and you still have glaucoma. So the best thing to do is not to sit in your house. Like you heard Dr. Allen and Dr. Sweta saying, once you get blind by glaucoma, it is irreversible. Perhaps if it is cataract, it will be removed. I couldn't drive too clearly, couldn't see too clearly. One time I climbed the sidewalk at the new bridge. 2 police officers ran to my car when they saw me. Oh, honorable, can we help you? They thought it was somebody else, but when they saw me, they said, oh, we're sorry, honorable. Instead of me telling them I'm sorry, they were telling me sorry. They wanted to help me to drive. I said, no, it's okay. But I could not tell them I couldn't see, because they were surprised that I climbed the sidewalk. And when they said, oh, no, I was just thinking about something. One of them wanted to help me to drive me to where I was. I said, no, I couldn't say. Yeah. Now, but when I went to do the surgery, it was removed, and I can see now I'm still driving. But with glaucoma, when that one makes you blind, just say hallelujah. Leave it with God. Let's take a short break, and when we come back, please call 0-777-511-977 or 0-886-511-977. Those are the numbers to call to be a part of this program. Let's take a short break.